might be in my voice and my stoutiness, but okay, my name is LeeAnn, and part of the final project of getting my BSN for capstone is we have to present a project to our coworkers over our research proposal, which is a paper we have created from start to finish of the whole program, 2 years. Anyways, so my topic is preoperative preparation and surgical site infections. These are going to be the main points of this presentation. We're going to go over the reason for topic, introduction, PICO, framework of different studies I found, literature review, design setting, and sample of my own little study I made, and then data collection and analysis, and my conclusion. Since I work on a post-surgical floor, I thought an interesting topic would be to compare the use of chlorhexidine and povidone iodine in resulting in surgical site infections. One of the main forms of hospital-acquired infection is from surgical site infections. These infections occur when microorganisms achieve access to areas of the body that have been operated on during surgery. These organisms then multiply in the tissues of the body. Surgical site infections represent a major source of illness among patients requiring surgery. The CDC recorded in 2011 that an estimate of 157,000 patients acquired a surgical site infection. A patient's probability of hospital readmission is 2 to 5 times greater with the occurrence of a surgical site infection. Also, these infections have huge financial implications to healthcare institutions. A reduction in these costs for the hospital can help facilities improve patients' overall health by taking part in other research topics. There are several different pre-op surgical preparation options that can be used on patients, with the most ideal being disinfectants that have a broad spectrum against both occupant and transient bacteria. Two of the most common options are chlorhexidine and povidone iodine. The reasoning behind the particular choice of antiseptic should be based on current evidence to achieve ideal results for patients. The term PICO is an acronym for a 4-step process that can help smooth the process of inspecting research writing. In the acronym, P stands for population of interest, I stands for intervention, and C stands for comparison, and the O stands for outcome. My PICO question is, for surgical patients, does the use of chlorhexidine reduce the future risk of surgical site infection compared with povidone iodine? In the question, P is surgical patients, I is the use of chlorhexidine, C is povidone iodine, and O is reducing surgical site infections. By researching and presenting this topic, nurses may be able to present these findings to the appropriate hospital personnel to help influence policy changes on pre-op surgical site preparations. Students had to pick a nursing theory that applies to the research proposal. I picked the environmental theory. The environmental theory is a patient care theory that focuses on improving the patient's environment to order and obtain health goals and treat diseases. The focus of nursing in this theory is to alter the patient's surrounding in order to effect a change in the patient's health. If any environmental factor is lacking, the patient can decline in health. It is up to the nurses to create an ideal environment and manipulate these areas to achieve optimal patient outcomes. With this theory being a patient care theory, nurses have to remember that different situations affect patients differently, and certain environmental factors affect patients differently. Patients have to alter those factors on a patient-by-patient basis. The environmental theory applies to the specific research because this research is comparing 2 different types of surgical site preparations to reduce these infections. Nurses need to be informed if there is a specific surgical site prep that can be used to decrease infection because unsanitary environments contribute greatly to ill health, and that the environment can be altered in order to improve conditions for a patient and allow healing to occur. Since environmental factors affect patients differently, nurses may have to use an alternative surgical site prep in certain cases. Nurses have to adjust the environment to decrease the risk of post-op surgical site infections. Students had to research scholarly primary articles about their topic. You have to come up with 5, and it has to be within the last 5 years to be valid information. So starting through. This specific article examined the rate of surgical site infections after the changes of this hospital's protocol for pre-op prep was made. The change in the protocol was switching povidone iodine to chlorhexidine. Participants in the study were females undergoing gynecological laparotomies. The participants were divided into 2 groups, with group 1 consisting of 145 participants that underwent surgery before the protocol change, meaning they're the ones that received the povidone iodine. And group 2 consisted of 111 females who were prepped with the chlorhexidine. The doctor who performed the surgery determined if the patient had any type of post-op surgical site infections. They were the ones examining the patient. The patient was then evaluated 3 weeks post-op. The end result was associated with a reduction in the overall rate of surgical site infections from 14.6% with a povidone iodine protocol to 4.5% with the chlorhexidine gluconate. This article wanted to find out which intraoperative prep solution used in the healthcare facilities for adult open abdominal surgeries resulted in the lowest occurrence of surgical site infections 30 days post-op. There were 167 participants, and these participants had elective open abdominal surgery. This type of article actually used 4 different types of preoperative preparation, but I just focused on the povidone iodine and the chlorhexidine. Only 2 patients had a documented surgical site infection from patients prepped with povidone iodine, but there were none documented from any that had been prepped with chlorhexidine. This article compared the prevalence of positive bacterial cultures at the C-section delivery incision site